Hi, my name is Dr. Flynn. I'm from the Reading Animal Clinic. I just want to welcome you first to our YouTube channel. We're going to hopefully be using this channel to show you guys different techniques, how to clean ears, how to trim nails, laser therapy. Part one is to kind of go through our puppy and kitten packs, just to kind of help go through some of that information beforehand. It can be a lot of information to take at one time, so we want to make sure that you get it from lots of different sources. It gives you some time to review before your appointment. This way you can ask some good questions to your doctor. So I'll go through the puppy pack in this video. So I have one in front of me. The first part is a little welcome letter, just kind of welcome you guys to the practice. In here it talks about the vaccines that we do for dogs, and we break it down into a core versus a non-core category. Core category are basically really important vaccines. These are vaccines that have potentially life-threatening consequences. So these are things that we really prioritize. Distemper and rabies are our two core vaccines. It just talks about what they are and how often we do them. And then the non-core vaccines are lifestyle based on risk. We have leptospirosis, that's a bacteria in wildlife urine that can cause liver and kidney failure. We have Lyme, that's of course the tick-borne disease. Most people are familiar with that from being in New England. The kennel cough is for boarding, daycare, grooming, play groups, that kind of thing, a bunch of dogs in a close confined area. And then the flu vaccine is kind of based on risk and need. The flu varies every year. We have the flu vaccine. Your facility may need it. If you need it, we have it. And if there's high risk, we also have it. It also talks about some testing that we do, like the poop samples that we send out to the lab, and it goes over common internal parasites that we'll see. It talks about socialization and behavior training. Prime socialization is anywhere between that 8 to 16 week mark. So it's really important to get the puppy socialized with other animals, other people in the household. Generally, we talk about vaccine status versus socialization, and we've learned that socialization is key. So even if all their vaccines aren't completed yet, that's okay. We want them interacting with animals that are well cared for, healthy, friends who have pets, being in a puppy class where everybody is screened are good opportunities for your puppy to interact with other animals. Their full vaccines probably won't be completed until after 16 weeks, and that's when that socialization period has already kind of closed. So we've learned that, ideally a textbook would say, yes, all your vaccines are completed, but realistically, it is important for these animals to get that interaction with other animals and people. And again, that may not happen until after that 16-week period, okay? Other things that this goes through, it goes through pet poison. So if your pet eats something that it's not supposed to, and it happens to everybody, there is a phone number here to call. They are open every single day, 24 hours a day, so you can go ahead and give them a call. They have a special discount if you have a Home Again microchip, which is the microchip company that we will talk about later. If you have a membership, it is included in there. So it's really good for puppies because often we're doing their microchip, they have that membership. So just keep that in mind when you call them. Other things in here we'll talk about, like emergency, where to go, what to do, and we do have an app too. So we want you to be familiar with that. It's called Pet Page. So you'd have to search for something called Pet Page. We'd have to have your email address already on file for those two to link together so that you can go ahead and look at your prescriptions, make appointments, requests. All of that is on our app. You can also send us pictures. We like seeing those, and sometimes we'll go ahead and put those on the record if you're okay with that. It's nice to see our patients as they kind of grow up. Next in our pack, I'll talk about emergency care. So we typically recommend Blue Pearl. They have a Charlestown location, and they also have the Waltham location. They are awesome. They have really good patient care. So if we are not here, then we would ask you to give them a call. If it's a life or death emergency and you need to get in as soon as possible, like things like having a hard time breathing and you can't make the drive, Mass Vet is closer. They are in Woburn. Okay, that's another alternative. In here we have a general brochure about just our clinic and everything about us. Our hours are also on the back, so give that a look through. Microchips, so we kind of touched base a little bit about that already. We talked about the pet poison hotline. Microchipping is something that's, I equate it to like a tattoo under the skin. It is a unique number just for your pet. It doesn't have GPS. A lot of people ask if it does. It doesn't, but if your pet were to get lost, the first thing that any veterinarian or shelter would do would be to scan them, and then it clicks saying that this is their number. We look it up in a database, and then we can call you and say, oh, we have your pet. They are here safe, and you can come get them. So definitely something to consider. Often we talk more about it when we do the spay and the neuter, just because it's a big needle, but you really can do it at any point, okay? Vaccines, we've talked a little bit about the core, the distemper, and the rabies. Those are the most important ones. For more of the lifestyle risk vaccines, we do have handouts. So that's that leptospirosis and Lyme, just some extra information for you to take a look. Other kind of dangers, the ASPCA is the pet poison line that is linked to. This talks about just some common ones at home. Like most people don't know about gum in dogs is really toxic. Grapes is another one that people often forget. So just kind of a good reminder of things in the house that we want to keep away from our puppies and dogs, okay? The last thing I kind of want to talk about with these guys is insurance. Insurance is really important. It just kind of helps cover your pet in case there's an emergency, or they even have policies for routine care. So there's two big policies that we generally talk about at our clinic, and we talk about Embrace as kind of an overall encompassing plan, and then we have Trupanion, which is kind of more of your emergent sick care. Generally on the puppy appointments, we are sending you home with these brochures. These are 24-hour activated insurance coverage policies. So all they ask for is an email address. You can activate it even in the parking lot after your exam. It gives you a free 30 days of insurance just to kind of figure out what you want to do, if you want to keep it, if you want to switch to something else, but in the meantime, you're covered. So it is really an important and valuable offer. If you were to just call them, they would make you wait 30 days. So it kind of takes out that waiting period because we had an exam today and hopefully everything went well and we were healthy. So it's something to consider. This kind of talks about what questions to ask when you're comparing the two, just what works best for you and your family and your budget, and that's all. So those are the main kind of puppy pack items that we go through. Generally, when we're setting up your first appointment, hopefully we'll have you come here and see this video. We'll have you go home with that handout so you can go ahead and read it through. Often we'll ask you to bring a fresh poop sample for us so we can screen for internal parasites. If you guys ever have questions, we always want you to call. Don't feel like you can't call. That's what we're here for. If an app is easier for you too, you can also message us through that. So I look forward to seeing you guys, and feel free to reach out if you have questions. Take care.